Sure. My name is Jared Magnani. I am an associate professor of cardiology at the University of Pittsburgh, and my work focuses on ameliorating and addressing social obstacles to care. We do this through a variety of means. We use smartphone and other technologies to help people with chronic cardiovascular disease improve their self-management and self-care. Chief goals include adherence to chronic medications. Well, I think there are myriad barriers to pursuing a healthy lifestyle. These are what we would call intersectional. Some of them relate to policy level in terms of how food is provided and accessible to people. Some of them are structural in terms of the neighborhood. People might live in either a food desert or a food swamp. Some of it is education in terms of people's understanding of what healthy food actually is. But I think another prominent barrier is having the resources to purchase, obtain, and prepare food. So what we're competing against is a landscape, an atrocious landscape of Burger Kings and whatever it is that's really just kind of poisoning our bodies. Americans want a quick fix, and we've been trained to pursue a path that will result in more obesity, diabetes, cardiovascular disease, and ultimately further morbidity. So perhaps you're referring to the statement from the American Heart Association in 2018 in which some collaborators and I examined the association between health literacy and cardiovascular disease. And there are very prominent associations. Health literacy is defined by Healthy People 2030 as the ability to use information and to act on it, not just appropriately. And as well, Healthy People advocates that organizations pursue equitable health literacy as well, with the goals being to improve health literacy. So this is a very important goal that we should have as part of the AHA and also in our clinical practices to help people to make sure that they can use the information we provide to make excellent decisions about their health and be actively engaged in their clinical decision making. So I participated in a great session which focused on technologies as well as Life's Essential 8, the most recent metric developed by the American Heart Association, which introduces sleep to the Life Simple 7 as well. However, what I think is really fundamental of importance of Life's Essential 8, looking at the presidential advisory, is that social context frames the way in which people care for themselves and the way in which we care for our patients and people as well.